Hi, everyone, and welcome to the Shared Harvest series. We are doing our second installment of learning more about Shared Harvest Fund. Today, we are talking about debt and depression and how this affects everyone. Okay, today the title is Debt and Disease, and we're discussing how the effects of mental health and student loan debt connects. Okay, so welcome. Let's see who we got here. I'm just going to give a little bit of time to see who is coming in on Facebook there. And then we're going to introduce our guests. I just wanted to say welcome from the Chicago area. It's cold here today. It's actually snowing in April. I don't understand that, but this is where we are. So welcome and thanks for tuning in today. You may be asking yourself why a platform like Shared Harvest Fund, which really focuses on using your talents as a student, as a professional, to give back to the community and pay down student loan debt. Why are we talking about mental health, right? But we have to remember that debt is one of the number one causes of depression, of anxiety, of even PTSD for a lot of people. Some of the things that we wanted to highlight is that, student loan debt affects 44 million people in our country today and encompasses about $1.4 trillion in overall debt burden for our society. So that's a lot of people that can be affected by having the insurmountable amounts of debt that they have no way to pay back. Shared Harvest Fund, for those who don't know, is a digital platform that I believe is groundbreaking in that we are marrying the talented professionals and students who are out there that want to give back to their communities. And we use their talents in the community, in the nonprofit sector, to help pay down their student loan debt. So it's a win-win for both. They sign up, complete projects with whatever social cause or whatever community organization they want, and then we will put a stipend and an amount of actual real money towards their student loans. So that's a win-win. Let's talk a little bit about mental health disease in the US. I just have a couple stats for you that I'm gonna read, okay? First of all, having a large amount of student loan debt limits people's abilities to participate in the American dream. You went to school to get an education to try to better yourself. But when you don't have the opportunity to pay that student loan debt back, what happens is you're delaying the purchase of homes, getting married, just being able to get ahead in life, saving for retirement, saving for colleges. And so what that ends up doing is that those symptoms of depression and anxiety due to financial stress are becoming larger and greater for so many Americans out there. One of the things we wanted to talk about, there was actually a recent study done by Student Loan Hero, which took over 1,000 respondents, and they found that over 61% of people said that just the stress alone and thinking about their student loan debt was becoming just insurmountable, right? And of these people, 67% of them actually have physical symptoms. Those are things like insomnia, headaches, muscle tension, things that can affect your everyday life. Insomnia, we know, leads to heart disease, all of those things, right? So all of these things are really relevant when you start talking about student loan debt, and a lot of people aren't necessarily talking about those issues. So that's why we're here today. One of the other things that we wanted to highlight was just the effects on mental health that having large amounts of student loan debt has. In that same survey, 74% of people reported some social isolation due to overwhelming feelings of depression and anxiety that occurred with having large amounts of student loan debt. So social isolation is where you get into running the risk of suicide, of many other sort of factors that go into how you interact with the world. And so we said, well, how do we help combat that problem while also being able to provide human resources to the nonprofit organizations? And that's where volunteering comes in. So how does volunteering help mental health disease? There's actually been plenty of studies on this particular topic, okay? In one study actually done by Carnegie Mellon University, we found that volunteering has positive implications that go beyond just mental health. It even tackles physical health, okay? So we know that volunteers have lower rates of high blood pressure. I'm a physician, I see it all the time in the emergency department. High blood pressure leads to strokes, to heart attack, to early death. So these are all things that can be beneficial by just simply volunteering, not changing anything else about your lifestyle, right? They even saw that people over the age of 50 who volunteered at least 200 hours a year had lower rates of high blood pressure. So these are how all these things connect. And so what we wanted to do today is just highlight that, not to depress you, but to let you know that Shared Harvest Fund is offering answers to that situation. What I'm going to do now is bring in one of our friends of the fund. Her name is Junie Francois Pswarayi. Bring her in. And what she brings to the table is over 10 years of experience in working with nonprofit organizations, in helping with programming, coordination, HR, finance, and the likes. Junie, tell us a little bit more about what it is that you do.
Yes, thank you, Brianna, for that introduction. My name is Junie, again, and I am actually the administrative director with another nonprofit. And I've been doing this work for about 10 years now, as Brianna said. And I was brought in to work with Shared Harvest Fund amongst friends because we talked about it, and it was something that I immediately lit a fire in me. I thought, wow, this is exactly what our communities need right now, something that marries volunteerism with nonprofit organizations that need work and help to help them do the programs that they need, and then also gives them an opportunity, volunteers an opportunity to pay down their student loan debt. I just thought that it was a win-win for all entities involved, and was just happy to be able to help in this particular way. Later on, we will be discussing how Shared Harvest Fund's model can help nonprofit organizations achieve their mission by giving them a steady stream of volunteers to help them, while also giving volunteers the opportunity to pay down their student loan debt.
Great, and we definitely want to hear about that. Can you tell me a little bit about why you think volunteerism is so important in the programming for nonprofit organizations?
Well, I find that volunteerism for many nonprofits is the backbone of their organization. Many nonprofits don't have the budgets, especially starting out, I would say within the first 5 years, to hire full-time staff. And so having people, competent people, skilled volunteers to help in that regard really helps to propel their programs forward and allows for them to grow in that aspect.
Great, great. Okay, perfect. So what we're going to do now, and why we specifically chose the nonprofit partners that we have today, is because they do amazing work in the community with mental health. I'm going to bring in Florie Saint-Aime and make sure, I'm hoping I am not mispronouncing your name, so please stop me. I'm going to have Junie just say a couple words about Florie and then let her introduce her organization.
Okay. Florie, thank you for participating with us here today. We are really appreciative of your time. Florie is a social worker with the Family Center, and also volunteers for time with another organization, Global Trauma Research, that does work on mental health. So I will let her speak about those initiatives and her work there.
Sweet. Hi, everyone. Again, I'm Florie Saint-Aime. I'm an LMSW. I do counseling and psychotherapy in 2 organizations here in Brooklyn, New York, nonprofits in Brooklyn, New York. And I think this is a great idea because I think a lot of people don't really spend the time thinking about how our economy supports or support's not the word, can be a real detriment to mental health, to individuals. So I think it's a great opportunity to really talk about those connections because they are very real and they're not often spoken because it feels like individual people not doing what they need to do, but it's actually something that we can, as a society, work on to increase mental health and economies. Yeah.
The next thing that I was going to ask is, what are the mission and goals of the two organizations that you work with?
Yeah, so the first organization, the Family Center, we started 20 years ago, about to be 22 years ago. Our founders were women that worked for the Department of Health. And at the time, the HIV epidemic was really high. And what they were realizing that where people were family members, household members who were the head of household were dying due to this disease, and children and other family members were left to pick up the pieces, where the head of household used to do the laundry in the littlest things, but also was the breadwinner, and they were the reason they paid for school and such. So they decided that we need an organization that's not just going to help the individual, but is really going to be there for the family throughout and after a person's passing. And they began, and they were tiny, and now we're huge. And by huge, we aren't that big, but we're big enough that we now have a preventative service. We have a mental health clinic, which is specific to children who have a mental health diagnosis. I work in the Family Support and Counseling Program, which is specific to people who are either HIV positive, dealing with any kind of cancer, or caregiver, which is someone who's raising a child that is not their own. And all of these, supporting these people through these huge life decisions and choices that they're going to be continuing to make. And then we also have quite a few HIV services here, and caregiver support services, so for people raising children that are not their own. For Global Trauma Research, Inc., they are located on Church Avenue. They're primarily for the community-based Haitian, Caribbean folks who haven't always been taught about mental health and aren't really sure about what its use is in their lives in particular. And they have a really great way of reminding people that mental health is something we actually all deal with, whether we've gotten a diagnosis or we've ever actually been able to identify a symptom in ourselves. So there I do clinical work as well, meeting with people one-on-one. And it's great there because we get to really see people start to embrace mental health as not a big taboo topic, but it's actually something we're all experiencing and noticing it in other people, noticing in themselves, and really feeling like they're equipped to deal with the problems of life.
That's awesome. Mm-hmm. And with that being said, what are some of the challenges you think in meeting some of the goals for, both of those organizations, especially since they have a lot of similar goals?
I think definitely what you mentioned earlier is budgeting, right? With any nonprofit, increasingly the budgets for social service are getting smaller. So we have quite a great batch of folks who are right out of college or are really eager to get into the field. But when they get here, an organization like myself is completely packed budget-wise of the amount of people that they can hire, right? So we're up to the max of how much we can afford, but it doesn't mean that we're not getting more cases. It doesn't mean that the world has less mental health issues, that they aren't still coming in. So then it has us rely a lot on funders, right? And funders have very specific requirements. And it kind of can be great because obviously that's money to do the work, but it also can be very limiting because that is money to do a specific type of work. So I think the idea of having people who are on board, who are supporting the mission directly, maybe not so much through what the funders are looking to support, but that direct mission, it kind of gives you the ability to flex a little. The places that you technically aren't being you're not receiving the funds for, you can service the things that we would call pro bono work. It gives us that opportunity to do that. And I know we do it as much as we can. We kind of just like, let's just put this person under that contract there. But volunteers really help so that it doesn't have to be this this secretive thing, but something that we could take pride in, that, you know, we're giving services that we wouldn't be able to do if we didn't have folks there that were willing to support the mission, not just the funders.
And so with that, have you seen a decline in the number of volunteers at your organization? And why do you think that may be? And I think I can imagine, like, how would a steady stream of volunteers impact your efforts there?
Mm-hmm. I would say that because of the nature of our work, confidentiality is a very big part of it. So volunteering is always something that has to be very particular in how someone's chosen to be a volunteer. So actually, a lot of the people spaces that we would have volunteers, we now have interns, right? Because they have to be there for a year. They have to be there for a steady amount of time. That way, the issue with confidentiality is not as screwed, because coming in and out, there is the potential for someone to learn of someone's status, and that's actually a very big deal legally. So having the ability to kind of have steadiness or consistency rather is actually really important for this kind of work, especially when we're dealing with mental health, and also at GTR, because of confidentiality and the requirements around that, and knowing and trusting the folks that are coming in and out, that they are invested in that confidentiality, and not only invested, but they're tied to that confidentiality as well. Instead of having people who are great for like an event or something, but in the long term, they're not pushing the mission forward, right? They're helping us for a day, but that day is one very small part in what we do every day.
Awesome. And I also would be saying that, think that that's somewhere where Shared Harvest Funds model comes into play, where we'd be able to provide volunteers who have skills in that particular area and are already working and established in another area, and feel as if they have the time to commit long-term ways to an initiative or to work like this.
Yeah.
That sounds good. The next thing that I think I would ask is, why do you think volunteering is particularly important with regards to mental health and well-being?
I personally volunteer as my self-care. So there's a certain amount of overwhelm and helplessness that you can get being in a world where we have direct access to lots of information, and constantly feeling as though there's not enough that can be done, and that hopelessness there. And in actuality, that is also a major part of depression, along with that isolation Brianna mentioned earlier, but it has a lot to do with feeling as though the world will turn without you, right? Like it'll keep going with or without your being there. And volunteering for me, I know that when I'm really feeling that hopelessness, I've done all I can do. I don't know if there'll be a different outcome than what I've been hoping for. Volunteering for me is the reminder of where my control is. It's the ability to come in and see a direct impact of what I'm doing, where there's so many things in our lives that we don't actually get to see the direct impact until years and years later. We can reflect back and say, oh, that's a impact of that action that I did 15 years ago. But volunteering gives us that immediate impact, which is really helpful to the ego, to really allow us to remember that everything is not out of our control. Actually, there are things very much so in our control, and we can give goodness to the world where we feel that we may not be able to find it. And so volunteering for me is a direct self-care method for myself. And it is a feel-good. It's a feel-good, and you can feel good and do good on top of all the things that we do every day that may not necessarily give us those outcomes.
Absolutely. And again, I come back to my favorite phrase, a win-win for giving us, the volunteers, an opportunity to give back and to reaffirm life, and also to help others and organizations that are doing this kind of work. So thank you. And next.
Hey guys. So it's a great, thank you so much, Florie, for talking more about your organization. I think the work that you guys are doing is so important. I will say that just even for myself, personally, so many family members who've been affected by HIV, AIDS, and mental health, even for the people who know me, know how important that has been, even in my own life, in my own family. So this topic today touches home for me, and it's just kind of why, even though I not used to being on camera, why I wanted to host this today. So thank you so much for sharing.
No problem.
What we're going to do right now actually is welcome another organization, the Elgin organization, which is actually the Elgin Foundation out of California with Melitta Johnson. They're focusing on getting out information about mental health into the community and assisting people with mental health and taking away the stigma of mental health disease. Let's bring her in.
Hi, good morning. How are you doing?
We're well. How are you, Melitta?
I'm doing very well. Thank you.
I'm on the East Coast, so it's afternoon for us here.
Oh,
That's fine. Thank you. Thank you so much for joining us today and for participating in this live discussion about mental health and the importance of it here. I was just going to ask for you to tell us a bit about yourself and your organization. What are your mission and goals? So yes, take it away.
okay. Hi again. My name is Melitta Johnson, and the name of the organization that I founded is called the Elgin Foundation for Wellness, and it is primarily a mental health wellness foundation aimed to eliminate the stigma of mental health, mental illness, and to prevent suicide. Um, our mission or what we're trying to do is to rise, and it's the acronym. It represents supporting research, so that's the R, impacting communities, scholarship development and distribution, and then education. So we want communities to rise out of the mental illness stigma, rise up so that we can achieve the things we want to, and really let people know that there is hope. There's hope, and that you're not alone. A lot of the times when we are talking about issues of mental health, we, or if you're going through a mental health crisis, you feel alone. And it is ultimately our goal to help others not feel alone, especially when they are going through it or when a loved one is going through it. The foundation was founded out of tragedy. My brother died by suicide in 2012. So he had been struggling with his mental health for some time, but we never really recognized, or we didn't know the signs. We didn't know what to look for. We weren't exactly sure what was going on, and so what we thought were small things were actually quite large things. And so, when you reflect, they always say hindsight is 2020, and that is probably one of the most real statements, I know. But when we look back, we're like, oh my God, that could have been it. Or what about that time where he just sort of disappeared at that time? Small things though that turned into huge things that now I recognize, and now I feel like through the foundation we can help save lives through sharing information, through walking people through steps that we didn't know about, through providing them with the resources that we now have, and just spreading the word. The more conversations I have about the Elgin Foundation or about mental illness or mental health wellness, the more people actually come about, and say things like, oh my God, my mom has always struggled with bipolar disorder. What do you recommend, or do you have resources where, and these could be people that I've known for like 5 or 10 years, and you never know exactly what they're going through until for me, I serve as that beacon. I serve as that torchbearer for hope, and just say, okay, look, this happens. It happens to just about all of us. You look at 5 people, one of them is going through some sort of depressive episode. Like, we are all going through it at some point in time, and we can all sort of, bridge a gap and be there for one another. And I really hope that the Elgin Foundation can be that for other people.
That is wonderful, and I really do appreciate you sharing that. I find that it's the personal stories and the reasons why some of these organizations and things get started is what really is the foundation for the work that is being done. And I wanted to ask you, what are some of the challenges that you've found in meeting the goals of eradicating?
You know what? I couldn't hear the last sentence. You said, what are some of the challenges?
Yes, what are some of the challenges in meeting your goals in eradicating the stigma with mental health and just helping to share information about how people can get help? Like, what are some of the challenges there?
I think for me, the challenge for me would be um, becoming more acquainted with social media. So I'm not as young as the young people, and they can get information out quickly and effectively. And as I learn more about working a network, because I can talk to people on an individual basis, one off here, one off there. But if we could really have a strong social media presence, I think that is key. And so we have interns who we have, employed to help us because, the young people, I mean, I have a 13-year-old. She doesn't have social media, but she can work that internet. And I'm like, goodness gracious, so we depend on some of the young folks to get our message out there and across that we can have an impact globally and not just locally.
Wonderful. And to that end, I would say that it sounds like the type of volunteers you need would be those people who have experience in social media and marketing and in that regard. So, how does a steady stream of volunteers impact your current efforts and just even some of the programs and things that you envision moving forward?
Yeah, I mean, we could use that, that would be a tremendous help, like a huge resource if we could get more volunteers that specialize in marketing and social media and stuff like that. That would be awesome. Yeah.
I also wanted to ask if you've seen a decline in the number of volunteers to your organization, or has it been steady? What are your thoughts there?
No, the volunteers, they are there. I think what happened is a lot of folks knew my brother and they knew his story. And so when I reach out to them, they are willing and able to do whatever I ask of them. And so we haven't had a decline in volunteerism, but we are a brand new organization. Like we will be 2 in August. So I pray that we don't see a decline. I pray that we only grow and encourage other people to join in this mission to bridge a gap and let people know that we're all going through something at some point in time. We can all be there for one another, and if we can, just sort of spread this message further, like beyond our sort of circle of influence, beyond that circle, and go further outside of that circle, we will be continuing to do our jobs.
That's wonderful. Well, thank you for sharing the work that you're doing with the Elgin Foundation. And I am hopeful and certain that Shared Harvest Fund is something that can help benefit your mission and your goals.
Yes, thank you so much for having me. It was definitely a pleasure.
I think we lost you there, Melitta.
Rose.
And it froze you. What I'm going to talk about now a little bit, Melitta and Florie, you guys' organizations, as I was mentioning before, touches me in such a way that, and I actually haven't really even shared this. If you're not like super close to me, you don't know this, but about 2 years ago, my husband was a late diagnosed bipolar disorder. He was diagnosed with it late, shortly after we had our first child. And he, in fact, 2 years ago, committed suicide. And so a lot of people are not necessarily aware of that. I don't talk about it much. So I think what Melitta was saying about the stigma, some of it was just emotionally, it's hard to deal with that when you get the outpouring of love, even though it's great, you have to be ready to receive all of that and to talk about it. And I think her speaking about the stigma of it was not necessarily for me as a physician. I treat mental health just like diabetes, cancer, hypertension, and we need to really start moving that conversation that way. But then it makes me even ask myself, why at this point, I haven't really put it out there. So this is actually like my coming out, because you guys are inspiring me to even talk about it. And really, for me, this is a lot of where Shared Harvest Fund comes from, the drive for me to get it out there, because I know that the stress of money and of just, making finances work and those sort of things. And when you feel like you have a potentially debilitating disease, where that can take you. And so, and not recognizing those signs and talking about those things again, because you're missing that because of the stigma. So I'll share that. And thank you, Melitta. I don't know, I think we lost you on the broadcast, but you were amazing. We are going to now take a couple questions from the audience. I'm not sure how many people are there. I'm going to bring Florie back in just in case people have some questions about the wonderful work she's doing with her organizations as well. And then we'll make sure we give the information if people want to find out more about your organization, Florie. And hopefully when she comes back, I'll put that website information up there as well.
Okay.
Any questions from the audience? Let's see. We have one. It says, what are the challenges you see volunteers are facing? I think what that question maybe means is, why is it that somebody might volunteer for a day or two and then, decide to not come back, or you're not seeing that consistent level of volunteerism that you need to reach your mission goals?
I can try to tackle that. I would say life keeps lifing. The volunteering, I know myself as someone who just spoke about volunteering being a self-help, self-care method for me. I love volunteering. There's a local farm nearby. I love going to volunteer there. Sometimes you really need to just get like really dirty volunteering, and I often, I'm going this Saturday. And I don't. And I think what happens is that other things get in the way, things that are requirements for your life come in and remind you that, hey, you have this other thing. But I think also it's because they didn't really know me there, right? So like I come random Saturdays and I do some heavy lifting, I do some dirt, I do all these things, and then I leave. And then it'll be a couple of weeks before I feel like I need to return. And I'm like, I have to do this for myself. I have to go back. But I think what helps with that is that really becoming a part of wherever you're volunteering. And again, that goes back to the investment. Although I love that community farm, I love what they do, I respect their work, I haven't quite invested in it yet, so that I can kind of come in and out as I please. But really believing in it and seeing yourself as part of that mission, I think would really help with the issue of lifing, and it becomes part of one of the things that you need for yourself, not only for yourself, but part of the way that you are contributing to the world. And that stronger connection to it is, I feel, what would help with getting over scheduling and all the other things that like just really are small but powerful ways to keep folks from returning back to volunteering.
Perfect. Thanks so much for that, Florie. And I think a lot of it is just talking about we want Shared Harvest Fund to take people, even though, there will be some sort of controversy in paying people to volunteer. I don't think that's where we need to look at it as. Mm-hmm. I think people where they are. And right now, the freelance and gig economy is booming, and volunteerism, unfortunately, is declining. So how do you bring those two things together, and what's the marriage of those two? I think that's really what we want to look at and be realistic about the situation. So I think, having people, unfortunately, self-interested to some degree because they want to pay down their student loan debt, consistently volunteer with an organization, that's how you get that buy-in. That's how you figure out what it is. You even find out what those social causes are that you are interested in and have that be a part of your life. So I think we have time for maybe one more question, and then we're going to wrap up. Thank you guys for being patient. Just quickly, if you find out, how do you know where your volunteers come from? Are most of them students? Are they undergraduates? Are they graduate students? Are they professionals? Where do you get most of your volunteers from? That's for you, Florie.
Oh, that's for me. Okay. Our volunteers currently, so we have quite a few, it's actually interesting. Quite a few of our volunteers are people who are entering social service as their second careers. So folks who were previously in other industries and are now returning to school, perhaps for a social work degree or mental health degree or something of that sort. And they really want a taste of being in the environment, and they aren't required yet to do an internship. So a lot of them are taking the initiative to learn these organizations for themselves, because eventually in their new career, and educating for their new career, they're going to be required to do internships. But I think a lot of folks who've been in industry before know the difference between learning something and doing something. And they're kind of coming in with their own initiative to start in the field, learn what's happening, learn what fits for them. And it's also giving them a completely different approach to their education, right? So it's not textbooks, it's things that they're actually seeing and observing and being a part of. So I would say a lot of our volunteers are actually people who are in their second or third careers in their lifetimes and deciding that they want firsthand experience of what it's like to do this kind of work.
Great. Yeah. And I think that's so important. That's one of the things that we thought about when we started thinking about Shared Harvest Fund, looking at recent graduates who may not be able to find jobs, but need hands-on training in the field of their choice, whether that's, you're a hairdresser, you just got out of school, or you want to become a licensed social worker like yourself, and you need that hands-on experience. This is a way for you to get that on the job, training, and get some experience under your belt. So I think that's important to talk about and to highlight as one of the pillars of the program. We had a good question here. This is a little interesting. It says, with all the recent school tragedies, the youth are being bombarded with images of violence, and the question of mental health is consistently raised. What is the relationship between mental health organizations, students, schools, and specifically creating spaces where students can talk about what they're dealing with? I'm going to bring Melitta back in while we're chatting, but anybody want to take a stab at that?
I'm going to say I missed the exact end of that, but I'm going to pull in what I heard. There is, I think what people forget about mental health is what we do is we speak to people all day. We speak to people all day about things, and we really help push how we're interpreting the world and our place in it and our role in it, right? So the importance of having students have a space, if I heard the question correctly, to speak about all the violence that they're experiencing through media, but also in their actual school environments and in the world that they're living in. The importance of that is pushing to see that these things aren't isolated events, and helping students to see that they aren't, in fact, helpless or just rolling along in the world. That a lot of these students can make really big decisions. And I think some of the students that had the opportunity to have these kind of discussions are the ones that we're seeing on the media now, who are really leading these movements, because they've had the spaces for people to tell them, what you're feeling is completely valid and inappropriate for a child to have these kinds of fears going to school, right? And after they've had people discuss this with them and validate those feelings and not tell them that it's something that they're individually experiencing, they realize that they need to do something more, and they're taking to completely changing movements that we've never seen coming out of schools, right? And young people being the absolute forefront. We've always had young people doing the groundwork, but it was always an older someone else who was the face of these movements, but now we have them. They're the faces as well as the groundwork folks. And that's because they've had the opportunity to really get into these with someone they trusted, a few people they trusted, who allowed them to really question things rather than accepting them.
Right. Melitta,
I missed the question.
I was gonna pose that. I'm gonna give it back to you, Melitta. Sorry, I didn't mean to interrupt. Because I know you just got back in. Welcome back. I think this is a really good question for you. They were talking about the recent school tragedies and all the violence that the youth are seeing, and that the question of mental health disease and where we're going with that. How do we talk about it? How do we take away some stigma? How do we recognize it when we do see it and intervene? What is the importance of the relationship of mental health organizations like yours and creating safe spaces for students and schools to talk about these issues and to deal with them?
Well, I think just to start off, the children these days, they have it much harder than I had it as a child, and maybe some of you as well. They're dealing with things that we didn't have to deal with. They're dealing with different types of bullies. They're dealing with bullies who have access to the world. My husband is a principal at a school, and he sees all sorts of tragic things that happen between students. So where we had normal sort of what I considered a normal sort of bullying situation is sort of one-on-one or maybe a three-on-one. You have an entire world that can get access to something that happened to you on any particular day at any particular time. Another thing that the children are dealing with is, sort of the access to social media where they may have a serious case of like FOMO or something, right? So they're invited to events or something like that. So like my daughter had a birthday party and people were on Musically and all these different social media resources, which my daughter doesn't have access to right now because of how I feel about it. But anyways, people were posting all these things. So by the time she got back to school, the entire school knew that she had this Black Panther birthday party that they weren't invited to, and it makes them feel a certain type of way. And so, sort of tying everything back to the question, in addressing the issue, really, I feel like you have to talk about it just head on.
Mm-hmm.
You have to just talk about it head on. For instance, my daughter, she's 13. Last year, she was in the 6th grade. And one of her fellow classmates talked to her about wanting to die by suicide. And so my daughter knows the work that I do, and I'm very open with all of my children. So I have a 13-year-old, a 10-year-old, and a 7-year-old. And I talk about the work that I do. I partner with the American Foundation for Suicide Prevention, and I'll even have a sign on top, in my grass, a grass sign that says, donate now or come be involved in this walk. And so they'll ask me, Mommy, what is suicide? Why would anybody consider taking their own life? What happens with people when they make those types of choices? Like, why will people be sad? So we have real conversations in my house, and I encourage those real conversations for parents to have with their children. Talk about the fact that 1 in 5 people might be dealing with depression right now in front of your face. As you walk across the street, or I'm here at a coffee bean. I couldn't get to my next location quick enough, so I'm here at Coffee Bean. Somebody here is struggling with depression. Somebody here might have just had an anxiety attack. And those things are real. So the things that you say every single day, you don't know how it can affect somebody else. I tell my children, you don't know that the words you say today affect other people. I remember things that people told me as a 6th grader. I remember the mean things that people would say. And I was resilient. I was called an African booty scratcher and all these different derogatory terms. I could deal with it. Everybody cannot. And so you have to be careful about the things that you say because they can have a lifelong lasting event. It could be a lifelong lasting event for that particular person. And what we're doing through the Elgin Foundation is we have developed a mentorship program because we recognize that the rate of suicide is increasing amongst those 10 to 24. And 2016, that rate has increased, and we want to be at the forefront talking to young people to tell them that there are options. That is not the only way. You have an option. You are loved. Even if you don't feel the love today, currently, you are loved. you don't have to make that step to consider suicide, because there is hope. So going back to the girl who told my daughter that she was thinking about dying by suicide, the week before she bullied my daughter, right? But my daughter, my daughter cried. They did all this stuff, and the very next week, that girl was bullied, and she considered dying by suicide. So immediately, my daughter called me, and I called the principal, and we had an intervention right immediately. Immediately, that girl. So my daughter knew though to ask the girl questions. So what I've been trained to do, I'm not a therapist. I went to UCLA. I got a degree in psychobiology, but I'm not a therapist. I am just one that unfortunately experienced, suicide from my brother, and I just want to be that advocate to help others. But in my training, though, one of the things that was asked, that we say if we know that somebody is, has suicide ideology, is to ask them, do you have a plan?
Right. Yeah.
Do you have a plan, in carrying out this suicide? And she did. She said, yeah, I could jump off of this bridge over here by my house, or my dad has a gun. Maybe I could shoot, or I could slit my wrist. And it was devastating. So we called the principal. They had somebody sent out to the girl's home. And of course, what happened after that, but the girl she did return to school, and she is much better. So I'm assuming that she received therapy. And even though the girl bullied my daughter, we taught my daughter to sort of see past that, because she clearly was dealing with something that we couldn't comprehend. We didn't know what she was dealing with, and my daughter doesn't know what she was dealing with, but we knew that she needed help. We couldn't just ignore it, and we can't ignore anybody who might be saying things like, I might want to kill myself, or want to kill somebody else,
right,
or want to harm anybody else, because a lot of the times we become stigmatized in our own communities where that boy, he just has an attitude, or that girl, she is whatever, but they're probably also dealing with something in their life, and they don't really know how to express themselves as young people, and that outward aggression is the interpretation or the expression of whatever is going on within
right.
their
Thank
experience.
you. Thank you so much, Melitta. I think you missed when I revealed even about my own husband and his suicide 2 years ago.
So your husband died by suicide.
Yes, correct. And so I think what you're speaking about and talking about how this affects people, and just even knowing, and as a physician, even myself, you're obviously trained in looking for signs, and so am I. And it's like, to miss that in your own family, you just think, gosh, how many other people are being affected by it? I mean, we could talk about this all day. I want to start wrapping up, but thank you so much for sharing that story, and for the beautiful work that you're doing, not just with your organization, but with your own child. I mean, this is something that we need to be able to let our children know is happening, because it is happening. Cyberbullying is a real thing. And it's important, and she saved a life because of you. So thank you for that. What I did want to do quickly is just let the audience know how to get in touch with you guys and your amazing organizations. Melitta, I'm going to put you on, and then I have the Elgin Foundation, the website available for people to contact you. I have the elginfoundation.org. If you guys want to know more about the wonderful work that Melitta is doing, please go to the website and sign up to help. If you're in the area, you see what she needs to be able to get this platform global. So if you have any sort of tech skills, advertising skills, any of those things, please reach out and get that going for her, okay? Because she's doing obviously some amazing work, and thank you. Also, I wanted to just highlight Florie and the organizations that she works for. If you want to get in touch with her, you have both the Trauma Research Inc. at www.gtrinc.org. And then also she works with the Family Center in Brooklyn. Shout out to Brooklyn.
All day.
www.thefamilycenter.org. Thank you, ladies, for being a part of the conversation today. Don't forget, if you guys want to find out more about us, we're at www.sharedharvestfund.org. Okay, I'll put that up here really quick. so you guys know how to get in touch with us. And then also don't forget that our Kickstarter campaign is 107% funded. We need more volunteers and we need the money to get this platform going so that we can really help these organizations that you heard about today. So be sure to check us out when you can. Thank you guys so much for being a part of the program today. I will sign off. If you guys need to find us anywhere or reach out to us, we are at people@sharedharvestfund.org. Okay, and then once again, our let's see. I just wanted to show quickly the Kickstarter page is here, and we are ready to go. We're almost there. Yay! All right, guys, I'm going to sign off. Thank you guys for your time. And for more information, please reach out to these wonderful organizations. And we will see you soon. Thanks.
Thank you so much. Have a great day. Bye-bye.
Bye, guys.